Welcome to the Modern Patient Experience, a show about how U.S. healthcare is adapting to new patient expectations. I'm James Furbush, Director of Marketing at Access One, a company that empowers revenue cycle teams to help all patients effortlessly pay for care in full or over time. In each episode of this show, I interview executives from hospitals and health systems, physicians and nurse leaders, digital health pioneers, and others to better understand what it means to be truly patient-centric. The goal is to serve up new ideas, frameworks, and tactics that will help your organization give your patients the best clinical, financial, and operational experience. And away we go. Hi, welcome to this week's episode of the Modern Patient Experience with your host, James Furbush. My guest this week, very excited to have on Michelle Abeyta. She is the co-founder of RNNovations, and I'm really excited. We're here this week to talk about the importance of nursing for the patient experience. When I think of the patient experience, the first thing almost that comes to mind more than anything else is nursing, right? Nurses are on the front lines, taking care of patients, whether you're in the hospital, whether you're at a outpatient primary care clinic, no matter where you are in your healthcare journey, there is a nurse there to help take care of you. And so I'm just really excited to talk about this with you personally. I'd love to for you to give a quick overview of what you're up to with RNNovations, your history of nursing. You are a second generation nurse. Is that correct? I remember you saying that.
Yes, my mom is an ICU nurse. She's been an ICU nurse for 25 years. She's just going to retire this upcoming February when she turned 65. So she was working through the pandemic. It was quite something.
Well, God bless her. That is to work at that stage of your career to push. That is not easy. So much respect to her, certainly.
Thank you. And then my experience. So I have 10 years of clinical nursing experience. I started out in a pediatric ICU and a nurse residency program. Loved it. Was in it for 6 years. I transitioned to a pediatric CVICU. I love working with children and their families. And then I became a nurse educator in pediatrics and pediatric ICU. And then I went back for my master's as an FNP, so a family nurse practitioner. And then now, starting this new exciting adventure with RNNovations. Like I said, I co-founded it, and it's a part of the Port Product Lab here in Oakland. We realized that there's not really a great community for nurses to come together in regards to innovation. And we found that nurses are largely missing from that conversation. And it's a missed opportunity because nurses tend to be the end users for products and services. So why shouldn't they be included in the design, testing of products? It would make sense to me. And I think the industry is finally beginning to realize that we want to make a community or give them a platform to be able to participate in some of the exciting things that are happening within healthcare innovation. Aside from that, we're also building a transition to practice nurse residency program specifically designed for associate degree prepared nurses. So those are nurses with 2-year degrees. We really feel like they have been excluded a lot from residency programs. And it's a program specifically for community health as well, because in America, we tend to be more disease-centric, where we're focusing so much on what happens when the patient is sick, and we should be focusing on keeping the patient well and keeping the patient out of the hospital. So there needs to be greater attention to public health. There needs to be greater investment in public health, and we're trying to bridge that gap.
Yeah, that's incredible. We'll jump back to the first part, having nurses be part of, so are you talking like having them be part of the design of medical devices?
Yeah,
can you just go into that in a little more detail?
Yeah, there are nursing programs now. There are very few, but there are some that are actually building in innovation and bioengineering into their degree. to get nurses comfortable with that side of the industry, which I think is extremely smart. There's also innovation courses that they're offering. So we want to also provide that service for nurses, give them the opportunity to work with engineers, to work with a team that could build their inventions. This whole idea for RNNovations actually started with a nurse in the area that came up with a great idea, but she needed to find a place that can make a model of her product. And so she reached out to Product Lab, and then they were able to help her build this product that she had just thought of. So nurses have tons of these ideas. They just don't know how to make them a reality.
Yeah, and is this because they're in that sort of, I hate using like war metaphors, but they're in the trenches, obviously, and
Right.
I imagine a
Yes.
lot of times, right, they are jerry-rigging
Oh,
devices and
yes.
certain things and reconfiguring their environment to make it work for them, not against them.
And work for the patient, because not one product is well suited for every single patient. And so we have to get really creative in Mickey Mousing products together, of course, keeping in mind patient safety. But it would, I think, be better and products would be improved if nurses were included from the very beginning, not just in the testing phase, but from the design aspect in development. There's a lot of input and value that nurses can give to the whole process.
Oh my God. I think especially being the sort of end user, right? They've got that sort of natural, just that knowledge of how this would actually be used in a real world environment, whether it's going to work whether it's going to
Right.
work or not.
Yeah.
Uh,
And whether or not it's going to really, if it's going to work with their time, is it going to make their work more efficient or not? It's like I have nurses tell me all the time, and myself included, who designed this doesn't make sense. Like I said, including nurses from the very beginning, who are the people who are going to be using the product, is just smart. It's smart business.
yeah. And the second part of the mission, talk about the training aspect. Because that's what sounds important too, to connect it back to your mom retiring. They have reports of a lot of older nurses retiring. There potentially be a nursing shortage, which would not be good. But it sounds
Right.
like trying to get more people into the profession.
So there is a nursing shortage now.
Yeah.
The nursing shortage is only going to continue to get worse with the amount of baby boomer nurses retiring. We're going to lose tons of nurse leaders, so nurses with experience. So, it's really going to have an impact on the remaining nursing workforce. And then when the remaining nursing workforce feels like they're squeezed, they may consider changing careers altogether too. I've seen that so much, and I've heard so many stories of nurses leaving the profession altogether just because the pandemic has put such tremendous stress on our profession. The patient workloads have increased. They've been required to take on more patients, but then and more stress, and then also risks to their health every day. But nurses don't feel like they're getting their fair share, like they're getting a fair deal. If you're doing more work, you have more output, then what's the trade-off? There is no trade-off. Some hospitals, some health systems have given their nurses bonuses, have offered retention bonuses, have increased salary, but for the most part, it's a no. And when we're talking about nurses having other options, younger nurses especially will not tolerate not being heard, will not, they need support by leadership. And so they're not afraid to seek out other job opportunities, which leads to more turnover, which costs the hospitals more money. For each nurse that leaves, it's estimated on average to cost a hospital $40,000. Yeah. And
Uh,
that per
if they,
nurse.
and is that just hiring? What? Yeah.
Bringing in travel nurses, recruiting, all of that takes time, and it takes not only money, but it takes time. It takes 3 months on average to get an experienced nurse to fill that position. It can cost a hospital anywhere from $4 to $7 million annually in nursing turnover alone. I know hospital systems know this. Um, we just I think, and I'm going all over the place with this, but
No,
there's a really great quote by Sir Richard Branson.
sure.
He said, um, when, excuse me, clients do not come first, employees come first. When you take care of your employees, they will take care of your clients. And I think that the inverse is true right now, where it's very patient centric, which is great as a nurse, right? I'm all about holistic care. The patient is very much the center of what I do. However, nurses and healthcare workers are people too, and we need support. There's only so much output that we can give um, in order to maintain that quality of care and that optimal care um, that we want to provide. That is a part of who we are as a profession. So when hospitals make investments in healthcare workers, then they will see a return on investment down the line, but they have to be willing to make that investment from the very beginning.
Yeah, it's true, right? I think I say this all the time as a parent, right? As a parent, you want to bring your best self to take care of your kids, but you can't do that if you don't actually take care of yourself in some ways.
Right.
So what advice do you have for health system leaders in order to so part of it is, oh, if you want to prevent this from happening, you need to start like putting plans in place now. Retention bonuses are great and higher pay is always great, but that only goes so far. And so what do you advise for health system leaders who are thinking about this? Like, what do they need to do to better take care of their nurses in order to better take care of their patients?
Besides the prioritizing fair compensation for nurses, and we already talked about that and why it's such a big deal. Flexibility. Nurses tend to be women, they tend to have families, and you and I know well enough what happens during a pandemic when you have little children. If you can imagine mothers who are nurses having to balance that work life balance. It's extremely difficult, and a lot of times, what I've been hearing is that hospitals have been unyielding when it comes to maybe decreasing FTEs by a certain amount. There needs to be, if able, some ability to have to allow flexibility in a nurse's schedule in life. You can retain nurses by doing that. I think they've done surveys, and I think flexibility was the number one reason why nurses left their position, went to another job. I think that float pools are also important. So a float pool is a separate cost center where it's a group of nurses and they're trained to go to different units and backfill if there is a need in that unit and they're short on staff. So it's really important to have that as well, because it's a quick way of saying, hey, I need one or two extra nurses. Can you give me some? That's a no-brainer. Some hospitals have it, some don't. And then I was talking about very early on that we're starting a residency program. So nurse residency programs, the transition of practice from education to clinical practice, there's a big gap. And there aren't many nurse residency programs, and the hospitals that have them tend to be associated with the university, or they're bigger healthcare institutions who can fund this and have the infrastructure to support it. But it is my belief that it will pay, when it's not a belief actually, because it will pay for itself. You think about those numbers that I told you. New grad nurses who aren't in a residency program and just are flung into an orientation program, it might be 3 months, their experience is going to differ from a nurse who was able to get in a nurse residency program. The nurses who aren't in a residency program tend to have higher rates of burnout, higher rates of turnover, and practice issues within the first year. And new graduate nurses, 17% of them actually end up leaving the profession altogether within the first year, which is, when we're talking about a nursing shortage, like, that's a huge issue.
Yeah.
And I think that the reason being is that there aren't enough nurse residency programs out there to support that transition to practice, to support these newer nurses coming in, to give them the tools they need to be successful. And something else that is near and dear to my heart, it is to support associate degree prepared nurses. So in 2011, the IOM, the Institute of Medicine, came out with the Future of Nursing report, which I'm sure most people listening to this know exactly what it said, that they called for 80 increase in the proportion of BSN or baccalaureate prepared nurses to 80%. So as a result, hospitals and even hospitals with NRPs or nurse residency programs started favoring baccalaureate prepared nurses, which left ADN nurses in the dust, which is not fair.
No.
ADN nurses tend to be nurses of lower socioeconomic
Yeah.
status, tend to be nurses of color, women of color. And so I feel like we can help bridge that gap. We can get them on the same playing field as BSN nurses by giving them the opportunity to be successful. So yeah,
Yeah. And
that's
no,
a
I mean,
passion project of mine.
but it is right. 'Cause it's almost like when and this is not like a good comparison by any means. When you see job openings or stuff and it's a 4-year degree and this, that, and the other, and then it's like an entry level job, you almost disqualify potentially qualified people out of the gate because you're setting your expectations too high. And so it almost sounds because of that bach- baccalaureate. Oh God, I'm totally butchering that. But having that as a requirement, you're essentially disqualifying potentially very qualified people who could come in just because they can't afford a college education or they can't
Who can't afford a 4-year or to wait
a
to
four
earn
year,
an
right.
income to spend an additional 2 years in college. But an interesting point of all of this is that they may not get certain classes, right? The ADN nurses aren't getting like maybe leadership class, community health, quality and safety. However, we can bridge that. We
Yeah.
can work that into curriculum in a transition and practice residency. And an interesting fact is that ADN prepared nurses actually have more clinical hours than BSN nurses. So they have more experience in eh, with clinical hours. In other words, going into a hospital setting. So they're actually in a better position to be successful from the gate,
Yeah.
from the get go. They just need a little extra support when it comes to maybe some of these other items to help make them successful.
Oh, that's awesome. I'd love to hear more about this nursing residency concept. It sounds like maybe large academic medical centers and your traditional like urban hospital campuses will do something like this. But can you kind of what does that entail? What does that offer the nursing profession? And why should we try to bring this to other areas of the industry?
Um, Nurse residency programs, they've studied their impact on nurses in general, retention. Nurses that go through a nurse residency program have increased retention, increased satisfaction, their increased patient outcomes. So there's just less error reduction. There are a number of metrics that actually um, that are beneficial for not only the nurse, but the patients and the facility. It's estimated, I think, that hospitals that have nurse residency programs have an average 6 to 10% lower reduction in voluntary turnover.
Oh, that's
So that's
cool.
pretty significant. And then why I think it's important to get into the community health setting. It's not done. There are some programs here and there, but if you can think about it, community health is a lot of it is very isolated, right? It's not a part of the bigger um, behemoths or a larger healthcare conglomerate, whatever. So we want to get in, provide that training and that support. And I honestly think that if we start to focus more on that and get more nurses comfortable in the community health setting and public health, they're going to be able to provide more public health education to their patients, hopefully reduce the amount of ER visits, hospital admissions, increase overall wellness, which is what we should be doing anyway. Following up with patients who are discharged from the hospital. We need to have nurses for that. We need to have qualified nurses who are prepared to do this kind of work, and it's piecemeal at this point. So it's definitely an area that like I said, I have great passion in. I love community health. That's what I did my family nurse practitioner degree in was primary health. And I saw a lot of a lot of opportunities for improvement from that experience.
Yeah, that's incredible. Where would you like to see the profession? Is it really just getting more qualified people into the profession over the next couple of years? Are there areas where you'd like to see the nursing profession evolve towards over the next few years? Where do you?
So I want to see nurses, the nursing profession, which is typically undervalued. I want to see them included into conversations. If healthcare executives are having a meeting and it's going to affect patient care, it's going to affect nursing, and they look around the table and there's not a nurse present or there's not a nursing voice present, then that's problematic. There needs to be inclusion. And unfortunately, I'm not seeing that done as much as I would like. Um,
Beyond, do most systems have like a chief nursing officer at this point?
Most do, but when there are cuts to be made, it tends to be made in the other executive nurse leadership positions,
Yeah.
like informatics. Informatics is huge, and there are informatics officers. There needs to be a chief nurse informatics officer, and there aren't many who
No.
actually can bridge that gap between clinical and the technology piece. So that's also a missed opportunity for health systems when you're implementing a electronic medical record, knowing like what needs to be documented, what doesn't, and then getting a collaborative group of nurses together who can really speak to this from the front lines. And this is where shared governance comes in, right? This is a part of Magnet Pathway to Excellence. They have this embedded into their programs, and it leads to better patient outcomes when nurses are included in the decision making, in evidence based practice, in implementing best practices. That's also a place or something that hospitals can do. Excuse me. If they're not able to afford to do a program like Magnet or Pathway to Excellence, at the very least, start a nurse practice council within a couple of the units to help to get the best evidence based practice together and to modify policies and procedures to be able to provide better quality care, better patient care. Um, when nurses are involved, you really get increased satisfaction as well because they feel like they have a voice. They feel like they're being included. So I think it's a win-win for everybody. Um, and then where else do I see it going? Where would I like to see nursing? I would like to see more nurse leaders within the government. I would like to see, I know this is a big
Yeah.
dream. This is a big dream, but there's a surgeon general, but there needs to be a nurse at the same level. Yeah, we are a different profession altogether. So there
Yeah.
needs to be somebody there that can advocate for nursing on the similar level as a surgeon general. I also would like to see more nurses active within the policy, legislation, and like I was talking about before, innovation. But with policy and legislation, um, nurse to patient ratios. So this means one nurse to how many patients.
Yeah.
So typically in ICU, it's 1 to 2 patients. So it's a 1 to 2 assignment if the patient is not as sick. In med surge, it varies widely. In California, you can't have more than a nurse can't be taking more than care. It cannot be assume care for more than 4 patients because there's a law stating that.
Yeah.
But everywhere else in the country, it's just 6 to 7. And now with the pandemic, 8, 9. And so nurses are out there right now completely terrified that they're going to miss something because their workloads have increased.
Yeah.
And there's no way, it's impossible to provide quality patient care when you are spread so thin and you don't have the resources you need. So nurses being involved in policy and legislation to help push legislation to make standardize a national nurse to patient ratio, I think would just make a load of difference in keeping nurses in the profession. honestly, and providing better patient care because patients are going to, okay, let me get on my soapbox just for a second.
Please do.
So, when nurses have to assume more care for patients, let's say that an ICU nurse is asked to take an additional patient, or a medical surgical nurse is asked to take 2 to 3 more patients than what's normal, or an RN is asked to do a non RN related task, clean up the room or take out the trash. That's not a good use of a nurse's time, right? The nurse can have been busy taking care of the patient or giving patient education. What happens is patient quality decreases. We're talking about increased hospital acquired conditions like infections caused by the hospital or events caused by the hospital from poor care. And then we're also talking about increased length of stay in the hospital, which costs hospitals money. We're talking about decreased patient satisfaction and increased more patients are going to be readmitted to the hospital later because the nurse wasn't able to give the education that the patient needed to be successful at home. So all of these metrics actually a- adversely affect the facility, not just the patients, but the facility, because if any one of those metrics is off, then that leads to lower reimbursements for the facility by the insurers. And that will eat into the margins. There's so much benefit in investing in your staff, in your nurses. And I'm not just talking nurses, in your staff,
Yeah.
professional development, support your nurses. Granted, they've given nurses kudos and pizza parties, but it's not enough. It's not enough. There needs to
Yeah.
be more.
It's like ping pong tables at the office only go so far to make employees feel appreciated to a
Right.
certain degree. No, that's good. But that is a perfect example of really boils down to like why it's important for nurses to have a seat at the table, not just like the big table, but like every table, that
Yeah.
crops up in the organization.
And it's something simple that can be done. Like I said, if you can't do magnet, if you don't have the money to put down and invest for that accreditation, just start a practice council within a nursing practice council within the units to do all of this quality work. The nurses will have a voice. Nursing satisfaction will increase. It's a small investment with potentially large returns.
Yeah, that's incredible. Michelle, where do you go to keep fresh ideas and find inspiration for the stuff that you're working on as it relates to nursing or just in general?
I think my favorite part of what I'm doing is being able to connect with nurses and really listen to them and understand their experiences. That's the absolute favorite thing that I do on a given day. Um, and then obviously I'm on LinkedIn. That's where we met. So I really like to stay abreast of what's going on within healthcare, within nursing. And I also like to go to conferences. Nursing
Yeah.
conferences are a wealth of information. And I just recently went to a hackathon, a nurse hackathon, which
Oh,
was
cool.
very inspiring. It's called Nurse Hack for Health. It's um, done twice a year in the fall and the spring. And it was an amazing opportunity for nurses to get their feet wet in innovation.
Yeah, that's so cool. I'll have to check that out. So people who are listening, you mentioned LinkedIn, but where can they follow you or find out more about kind of the work that you're up to? Where can they go
Well,
to connect or?
yeah. So LinkedIn, Michelle Abeyta. I am on Instagram. I'm not very active because I'm not social media savvy.
Yeah,
We hope to be more going down the road. So we do have an RNNovations Instagram account. Um, and gosh, oh my gosh, where else? Where you can connect with me. I think the best way is really through LinkedIn.
cool. We'll drop your LinkedIn in the comments. We'll be sure to tag you so people can find you. Michelle, this has been great. Thanks for stopping by to talk about nursing, the profession, why it's important for the patient experience. And I think for me, healthcare executives, if you're listening, give nurses a seat at the table, invest in them, treat them well, and you will reap the rewards and the benefits. I really appreciate. I think it's a strong message, and in some ways it's easy, in some ways it's not easy. I appreciate you stopping by to share your insight on this.
Yeah, thank you so much for having me. Really, it's been a pleasure. This experience
Awesome.
has been really nice.
Thanks so much. All right. Take care.
All right. You too. Bye, James.